Hi. So it's been 4 weeks since my L5-S1 micro-decompression surgery, I guess it's called, or microdiscectomy, or something like that. Yeah, I'm a nurse and I don't even know how to pronounce it right. Kind of sad. Anyway, I'm not going to go into detail. I'm just going to give a brief 5-minute recap of the whole situation. So I had a herniated disc because of a work injury I had 8 years ago. Yes, 8 years. Eight. I've been suffering for 8 years, believe it or not. I got to the point where my pain was probably a 12 out of 10, and I would continue living my life like nothing because I had gotten used to it. My doctor is Dr. Co. I don't know if I'm going to be, stepping on any toes by saying his name, but he's really knowledgeable, really nice. He's in the San Jose, Campbell area. Look him up if you're having spine surgery or spine difficulties or back pain or whatever. Like I said, I'm a nurse, so I knew pretty much a lot of people that have had this procedure. Our ex-medical director also, which I had not called him, and he did call me yesterday, but I will call him. Dr. Thomas, I will call you if you see this. He had it done as well, but his was not by the same doctor, by a different doctor. His was not successful, unfortunately, so he had to go to the more. And that's what I've heard. I've always heard that, oh, it wasn't successful, this, and that. I don't, but I guess because it was a workman's comp thing, and it's, you go the least invasive to the most invasive first. So, yes, I had to go through this. My incision is about this big, vertical, on the opposite side of where the pain was. My pain was on the left sacral area. It got to the point where last year in August, and this is where I started again picking up that I wanted it treated. I laid down, like whatever, to read on my bed, and I could not get back up. There was no way getting me up, and as embarrassing as it was, I had EMT, fire people, and 911 all up in here trying to get me out of the bed, and because of the way the house is, there was really little space, so it was very not cool. Because I could not walk, I could not nothing. I couldn't sit down. It was painful. I was spasming. It was just terrible. So anyways, my surgery was on September 13th. So it was actually 4 weeks yesterday. The first day, you go to surgery, you're pre-op. It's an outpatient procedure. You go, do your thing. They take you in, Well, my doctor was a little late, and so we were all just like sitting around waiting. The anesthesiologist calls you the night before. The nurse calls you the day before. They all ask you the same questions over and over again, and you just answer. So we were just waiting around, At some point, I guess the other doctor, the anesthesiologist, called him, and he was on his way. He was there. He was like 5-10 minutes late, but everybody was worried because apparently he has a reputation for being there early. And he, of course, luck would have it that with me, he was there late. Not late, but just to make me more nervous again. I did request the PO meaning by mouth Valium, prior to anything. Once I got there, once they bring you to the back, they ask you, yes, I was anxious, of course. And once the doctor was there, and once they wheeled me in, the anesthesiologist put something in my IV, and that was the last thing. I remember, I was being wheeled into the OR, and that's all. That's all I remember. He didn't tell me to breathe. He didn't, because I had my gallbladder removed before, and it wasn't like that. When I was being wheeled in for the gallbladder, I was there and I was actually talking, and they verified what I was there for, and they did the aura check, which wasn't done at the thing, but I guess, whatever. It's an outpatient, and there was a hospital. So yeah, I was out. I don't remember. Next thing I remember, I was waking up to a nurse calling my name. She was calling me Carla, Carla, and I remember, waking up, and she asked me if I wanted my dad, and I said okay. And then she asked me if I wanted my mom, and for some reason I started calling my mommy, mommy. I said mommy, mommy. So yeah, my dad went out, and my mom is a CNA, so of course she was gonna help me get dressed and stuff, because she asked, do you want me to help you get dressed, or do you want your mom to get dressed? I said mommy, or whatever. I felt no pain whatsoever. I did feel nauseated a lot, so much that they gave me Sofran before I left. Was able to walk right out of there, got into the car, came home. My mom put me up the stairs, and that's all I remember about that day. I remember sleeping off and on during the day, and being like with it for a few, and then my mom told me take pain pills, and so I did. And that's how I remember getting up for a little while, walking out, and that's about it. I had a couple days where I was running a fever, but I'm not gonna go into that because that's just gonna freak anybody out. That's just what happened to me, and this is just procedure itself and results. I'm not gonna talk about recovery or whatever, but just know that everything that could go wrong, they explain it to you, infection or whatever, or etc. They explain it to you and whatever. So just know that I didn't have major complications, but I did have to go through some additional stuff that other people might not have had to. First week, the first 2-3 days I was fine, pain wise. Then all of a sudden on 3rd, 4th day, I felt pain. I'm not gonna lie, I was worried, but I didn't know that they had put a long-acting medication in there, and it wasn't until my first post-op that that they told me, and I was like, oh, okay, now that made sense. That made sense why I started hurting. Other than that, easy recovery. I'm still at strict no twisting, no bending, no pushing, no pulling, no lifting. It's up to 6 weeks because the bone, they want that to heal, or they don't want it to herniate again. So yeah, I have not been bending, I have not been twisting, I have not been doing anything that I'm not supposed to. I do believe I have always been a side sleeper. So I do believe, but I catch myself like I guess subconsciously I catch myself turning the way I'm not supposed to, and I wake up or whatever. I haven't been sleeping because I am well rested. I mean, I've not been doing anything, and the first 2 weeks that's all I did. All I did was sleep. I had all this sleep from deprivation from before, from pain, from work, from stress, whatever. So the first 2 weeks I slept, So now I'm like, oh, I'm not sleeping, but I'm not tired either. Let's see. So yeah, week 4 today, or yesterday. Pain wise, I'm not in any pain. I'm able to walk normally. I do up to 40 minutes of a walk. Haven't been I haven't been courageous to go on the treadmill yet. The doctor said it was okay as long as all I did was walk. The reason being is, like, I'm for some reason I'm prone to freaking do some stuff happening to me on the treadmill. And so I didn't honestly, I didn't want anything to get messed up. I wanted this surgery to go great or whatever. So pain wise, I'm okay. There are days that, I think I might overdo it. But then again, I'm not doing anything, which is what worries me. Because while I'm not bending, I'm not twisting, I'm not doing anything I'm not supposed to, and my job, that is my job. I'm a nurse. I pour medications. Nurses out there, you guys know. So bending, twisting, pulling, pushing, that's an everyday thing. Every day, up at least constant, at least when you're passing medications in a nursing home, constant 2-3 hours, medication pass, everything, hour, 2 hours, that's constant bending and twisting. So to be honest, I cannot give you yes, the surgery worked great until I return to work. And that's when I will see. Right now, when I was not working, I had days where my pain was minimal or whatever. But yeah. So as far as pain wise right now, I am able to get out of my bed with no pain. Whereas before, I would always hurt. I would always have like a spasm or something, unless I make a quick movement. I'm okay. No pain down my leg. No pain on my back. The only pain where I feel it is right where in the area where the surgery was, where they worked on, and it's focused on that area. I can point it out. So yeah. So that's my status for right now, and I will let you guys know how it actually turns out after I return to work. Okie dokie, and for now I think these are the only 2 videos I'm going to post, because I'm actually not doing anything. Maybe I'll post some more another day talking about, I'm learning violin. So yeah, I'll talk about that too. Okay, take care everybody, and yeah, if you have any questions, post them, ask them. I'll be happy to reply in a video. Just subscribe. Thank you.